Fine, this is all very grand. Thank you for having me. And I just wanted to open up by introducing myself as the assistant head teacher up at Stonyhurst College, which is in Lancashire in the north of England. Stonyhurst is a Jesuit boarding school with over 38 different nationalities of children, and it's been in existence as a school for over 400 years. So there's lots of themes and there's lots of kind of takeaways today that we could apply. And I think, again, one of the key things that I wanted to start off by saying is that we must thank the team of those who are still in the north of England with the weather, that are boots on the ground and are still working to support our young people who are still at school. And again, the thanks for allowing me to travel to Rome and to share some of the research that we've started to look at. So again, what I wanted to say is I'm not going to profess to be academic. I much consider myself as a kind of hands-on operational safeguarding lead in a very busy and diverse 24/7 boarding school. But it would be interesting to kind of just share with you why this kind of research came about, because part of the work I'm doing, this feeds into preparation. I'm studying with the University of Lancashire on the international safeguarding course that they're now delivering. And it's been very enlightening to kind of find that some of the issues and the challenges that DSLs face aren't solely applied to safeguard leads in England. So ultimately, for those who, again, are working frontline or more strategic, one of the biggest kind of risks and vulnerabilities to any organisation, but also for young people, is child protection and how we safeguard them. So what we decided to look at, and I'm saying we because I have a team who are working across 5 different international schools who have fed into the research. We got together because there are some challenges that no matter how much training and how much kind of CPD you access, again, coming back to the theme from the start of the conference, there is no one size fits all. And in terms of applying that to our day-to-day work, what we needed to kind of consider was how we would address this issue in terms of looking at how we addressing matters that arise from when we receive reports and disclosures. So in terms of context, obviously working in England, we have the statutory guidance keeping children safe in education. Now, obviously, that is not universally applied, and throughout this research, other countries and other schools do work to different guidance and legislation. But what we did find is ultimately the kind of core principles that guidance try to uphold is that everybody has to take an active part, no matter what level of the organisation or institution you're working in, but we all have a responsibility. I think some of the kind of issues that I'll kind of talk about in the next couple of slides are relating to the individual approach to what is, again, a child-centred approach, and how individuals who work within teams respond to that and how they prioritise it. We always say this could happen here, but with elements such as cognitive dissonance and other kind of barriers that we've found when we're working, it's that kind of understanding that, you know, we believe anything could happen here, but others don't. And that is part and parcel of some of the challenges that we have faced. So what we wanted to do is to look at the research and look at how better to tackle and understand the challenges that are faced. What we did was put out to interview. We contacted those who were working in DSL roles or similar, but often what we found is those roles weren't kind of protected as they are in the guidance in England, where there is a statutory job description for the role of the designated safeguard lead. These changed slightly in the different contexts, but ultimately the kind of common threads that were coming through from them were that, you know, the DSL or equivalent is technically the gatekeeper of the reports and the disclosures. They were often the kind of central point of contact for any concerns that were linked to child protection or safeguarding, but again, they're the ones who were most kind of drawn upon to make external referrals to other agencies such as the police, social services, or make referrals into healthcare support. So the research was showing that even though there are differences in approach, there are still kind of commonalities with the role and the challenges that are faced. So ultimately, as we were looking through that kind of the feedback, we needed to make sure that fully those who were participating were happy to participate. Again, it would be fair to say that safeguarding without a doubt is one of the most challenging roles in schools, but also it can be very, very isolating, and it can also be very, very emotional. So it is important for those who are participating in research to do it freely, but also feel psychologically safe to be able to discuss how these issues impact upon them. So what we did was design questions based on the feedback that we had taken and the common themes that came through child safeguarding reporting mechanisms, such as the systems in which we record themes, trends and patterns. And ultimately, what we were finding is that, again, you cannot see things just through one lens. And when we were dealing with children from different cultures and different nationalities, you could not, again, apply the one-size-fits-all rule to those. Things were very different. The things in terms of the cultural sensitivities were often complex. But ultimately, they were all like additional weights to kind of working through how we respond to reports of harm. So one of the other issues that we were finding, and from the feedback, again, it links to some of the things that we talked about throughout the conference. Again, considering Dr. Russell's work, the majority of kind of participants, 80%, were women in safeguarding roles. So again, it kind of fits in with the wider findings of research. But equally, and again in support of those who felt confident, not that they were kind of at a stage in their life, they just felt that they didn't need to kind of explain their thoughts. They were very happy to put across and advocate for children what they felt were the key barriers and concerns. But ultimately, again, what we were looking at is how they would respond to sensitivities, and what they were saying is that there are huge challenges, particularly working in independent fee-paying institutions, that aren't just solely linked to the kind of culture of where you're kind of based. It is cultures of different kinds, of socio-economic pressures that are often put upon people to gain certain outcomes. These included things like elements of confidentiality. Fee-paying parents believed that they had more control over the outcomes of potential reports, and there was evidence from the feedback that in difficult conversations that the staff were having with parents, there was an element of pressure that would not always, be helpful to achieve, the best possible outcomes for children, or were considered to be barriers to reporting. Again, these kind of threads and these kind of issues were apparent across all sectors, across 5 different countries, where the kind of demographics, again, are the same. But there is also added weight and added issues such as affluent neglect, which I'm really pleased to have seen is going to be discussed in another poster session. But elements such as confidentiality, what was kind of taken from some of the feedback was that parents expected nobody to find out. This often linked mostly to physical chastisement. And again, there was an element which has been picked up as well through parenting. And what we were finding is some of the bigger challenges were parents who were struggling with their own issues in terms of mental health, or there were multiple siblings in a family, and the kind of, the parenting styles that have been adopted were often a contributing factor. But ultimately, again, taking these into account, we talked about some of the kind of decision making. The majority of the team that I spoke to, again in international context, had never been privately educated themselves, which was an interesting factor. But also, in terms of that, There were children who would not realise that what they were talking about were adverse childhood experiences that actually were intergenerational. You know, so issues such as attachment and, you know, the fear of abandonment and the issues that came from their parents attending boarding schools as well was very much part and parcel of kind of the conversations around how we respond to those children's needs. So in terms of the kind of comments now, it would be interesting for the fields, and again, you may or may not have had, you know, similar feedback. But often what my staff and colleagues across the other schools were saying is that the institutionalisation, we've always done it this way, was also something of a real challenge and barrier. Interestingly, and again, the comments that were fed back, where I have colleagues in safeguarding roles, the judgment, if they would ask, parents would ask, do you have children? And if they didn't, they felt that was a disadvantage and that was something to be challenged. But again, these are some of the kind of, some of the feedback that we got as part of the research findings. So again, what we were working towards is like, where do we land the kind of operational support that we need to kind of put in place when we do receive a report. We also explained, like, the feedback showed that the influence of the optics around having a serious case or something difficult and challenging to deal with, the pressure from the organisation or the institution was a factor. Professional confidence, again, it was also a factor in some of the concerns that were raised, but ultimately it was a barrier. And ultimately, again, the issue and the theme that came from the results was that, you know, a child may report to one member of the safeguarding team and get a completely different response to another. So children would actually seek out the adult they felt they most trusted to make a report. But again, I think ultimately when you kind of started to unpick this, the added elements of kind of the culture around the institutionalised responses, policies, the external agency, statutory guidance that you know, we have to follow, schools adopting the response to changes in law such as a Crime and Policing Act in 2026, just a short time ago following the independent inquiry. Safeguard leads were quite overwhelmed in how they should or should not kind of respond. But equally what they were saying is that irrespective of cultural background, we have mandatory reporting responsibilities and that has to be prioritised. I think as it says here at the end from a summary point of view, it landed pretty much where culture is never a defence for abuse or neglect. And it's very much kind of part of that professional curiosity and the way in which we approach these sensitive topics that is going to be, and as they've said again as a kind of thread throughout the conference, it is ongoing work and it's about the learning and creating that space to make sure we address these as sensitively as possible. So thank you.
Thank you, Emma. Yes.